And welcome back to the Ron Erret Show here on News Talk 790 WPIC. Ryan Briggs filling in tonight for Ron. I'll be back, of course, on Thursday night also from 5 to 7. Here in the second half of hour number one, we have a very special guest here in the studio. We are joined by Tracy Schleip from the Primary Health Network. And Tracy is here discussing COVID vaccination and more specifically distributing it to equalizing the distribution of the vaccine here in the area. Tracy, thanks for coming in tonight.
It's a pleasure to be here. Thanks for having me.
Yeah, Tracy, first off, you just give us maybe a brief bio and then how you became involved with the COVID vaccine equity team.
Well, I am a registered nurse, and I've ran the track a time or two, so I'm pretty familiar with the community, and I've worked in a number of areas of nursing, and I have been passionate, is the right word, during this pandemic related to equity and equitable distribution of protective equipment, equitable distribution of health care, of testing, and of vaccinating. So when I heard about this position that was becoming available, and I was approached about it, I jumped at the chance because this gave me the perfect opportunity to direct my passions.
Certainly. And how did that come about? Was it something that that you could maybe sense was coming or evolved over the course of several weeks, or was this something that one day at 2 o'clock it kind of popped up in an email, or somebody stopped or called you and said, "Hey, Tracy, how'd that come along?"
Well, I've been involved in the community, very active in the community, so you can sense that things are happening. But in this particular case, it was the Buell Regional Health Foundation under the direction of Jen Barbarak, who decided that vaccine equity was definitely a concern here in Mercer County, and she and her board set about to do something about it. So if you look at the equity toolbox, you see that collaboration is a very important factor to consider. So what Jen and her board of directors did is they went out to find partners, collaborators, and it was Primary Health Network that stepped up to the plate. So the vaccine equity team, I should have practiced that word a time or two before I came on the radio.
That's okay.
Was formed out of the partnership of Buell Regional Health Foundation and Primary Health Network.
So the team is formed, and you start to take on this role. When you took over, and certainly overall COVID distribution, or vaccine distribution in the United States, and then specifically Pennsylvania and Mercer County, has been kind of uneven. It's been up and down, if you will. And then all of a sudden we started hearing, there are more vaccines available, and I'm sure a lot of people have thought, oh, it's going great, everybody's getting it, smooth sailing, woohoo. That is not close to being accurate, is it?
No, that's not at all close to being accurate. And those of us who have been working in the system and with different populations realized very quickly that there was an issue. So I'm going to take you back to when we first started vaccinating seniors. We're talking about the folks that are 65 and older that weren't necessarily living in a nursing home, but were out in the community. So what was the process for getting a vaccination? It was that they had to, most times, go online and use technology, find a place where they could get it, register to get it, and then wait for their appointment. And those vaccinations were few and far between. There wasn't a lot of vaccine available then. And so for many seniors, that became very, very difficult for them. And there were a lot of seniors that didn't get the vaccine in a timely manner, or we're finding now didn't get it at all, and we're just now starting to reach them. So I think it's important for the audience to understand what equity is, because that's usually the first hurdle to understanding what it is that I am doing. So if you think about equality as giving everyone a shoe, giving everyone shoes, where everyone gets a pair of shoes. Equity is giving everyone a pair of shoes that fit.
Exactly.
So if we're going to give everyone a pair of shoes that fit, then we need to learn what it is. What size do those people need? What kind of shoe do they walk in? How high is their arch? We have to find out all sorts of things about those people, and that's exactly what my team is doing.
Yeah, that's a very good analogy, because when we hear, people, the words are related, but they're not synonymous.
No, they're not.
So as I guess, so we talked first with seniors, and we saw the lack of equity there, and as things have progressed to where then we had the different classifications, 1A, 1B, and so forth that came after that for those who were not in that senior age group. But again, I'm sure we found that there was a lack of equity again in those demographics too, right?
Well, yes, for one thing, there wasn't vaccine available. So now we have vaccine.
There was a quality. Nobody could get it.
Right. It was a quantity issue.
Sure.
Nobody could get it. And then it became an issue of when the vaccine was being administered, that it wasn't necessarily at a convenient time for people, or where the vaccine was being administered. It was a place where people couldn't get to it for one reason or another. And we, any of us that have lived in Mercer County know that transportation can be an issue for people, especially those folks that are living outside of the Shenango Valley. I will say that the Mercer County Transit has received a grant that they are able to provide transportation to anyone to their vaccine appointment.
So we've discussed, with the different population groups, but what have been some, I guess, and you already mentioned some of the geography, but what have been some things that have, I guess, some common traits amongst those who have been on the short end of the equity? Is it maybe one thing that you can pinpoint, or is it a multifaceted situation?
It's a multifaceted situation, and working in healthcare and being a nurse, one of the things that I look to for guidance are what we call the social determinants of health. And the social determinants of health take on, there's a whole lot of factors, but we know that people who are healthy generally have access to food, access to fresh food. They have access to fresh air. They have access to facilities where they can exercise. They have access to the internet. They have access to information. They are able to get to where they need to go. They have access to transportation. There are a number of what we call the social determinants of health. So when I was announced that I was the coordinator of this team, one of the first things I did is I looked at the population in Mercer County and tried to determine where are those things lacking, because that's likely where I'm going to find folks who haven't been able to get vaccinated.
Yeah, and with that, it's when you think of with some of them, from an access to, as you mentioned, and not just when you say food, it's not just something to eat, it's something healthy to eat. And that's often a criticism of some of the big box stores or different things where they offer discounted food, for those who don't have as much income, but the food's not healthy for them. And in terms of it be classified kind of junk food or whatever. So I'm sure that's a big one right there, just for the economically disadvantaged being a first place to start, right?
Oh, yes. In fact, that is exactly where we started. So I'll let you know kind of what we did to start.
Absolutely.
How did we get the ball rolling? Because we've been in existence now for about 6 weeks. That time has gone very quickly. But it was only a couple days until we hit the ground and we had a plan in place and we started instituting that plan. So, the first thing I had my team do is they developed a database of all of the providers of vaccines in what we call the Buell Regional Health Foundation footprint. So essentially that's Mercer County, a little bit to the north, south, east, and west. And then we found out from all of those vaccine providers, what kind of vaccine are you giving? How much vaccine are you receiving? What is the process that you have to go through in order to get a vaccine at your facility? We took all that information, we put it into a database, and then we went out into the community with our laptops and our hotspots, and we went and started talking to people. And the first place we did this was at St. John's Episcopal Church in downtown Sharon. So you might wonder, well, why did she choose St. John's Episcopal Church in downtown Sharon? Number one, it was in close proximity to my office, so I knew if something messed up, I could probably get it fixed pretty quickly.
Right.
And they were I'm a member at St. John's Church, so I knew I had an in.
Absolutely, you had an in. So.
Do you remember that collaboration thing?
Yep.
And then the third factor was that they were doing food pantry distribution. So I could figure that people that I was going to interface there were probably people that had food insecurities, and they would likely be folks that may not have received the vaccine.
So that's certainly, so you go through there and you start to kind of build a database and get really a lot of information gathering. And we mentioned the economically disadvantaged, but I mean, that's certainly not the only thing from the transportation standpoint. When you get a population, and generally, not always, but a lot of times, there are older people who may not be able to drive anymore, or maybe depending on where they live. It's one thing if they drive to the local market that's a mile away and then back home, but to drive 20 miles one way, they're not comfortable about it, and maybe they don't have any relatives nearby, or they have difficulty getting the transportation. I'm sure that the geographic aspect was probably was one of the next ones.
Yes, yeah, it was. So I looked at the geography of Mercer County, and I started looking up toward Stoneboro, Sandy Lake, Jackson Center, and in those smaller communities that are further away from the Shenango Valley, and if I dare say, sort of the metropolitan center of Mercer County.
Sure. And it's a more rural area. I mean, that's
right. It's a more
it is.
rural area, and there are places up there where access to the internet is not always available to them. And as you said, it's a longer drive. There is a more senior population. So I started looking at how can I get connected up in that area. So whenever I go out, I'm looking for some sort of event, typically. Something or some place where there will be a lot of people, because I have to talk to 10 to 15 people before I get one person an appointment to get a vaccine.
Okay.
Either they are hesitant, they're not ready to get their vaccine yet, which is a whole other subject matter that we could start talking about, or they have been vaccinated, or they're waiting for their second dose. So it's those folks that haven't been vaccinated at all that I'm really trying to reach.
Okay.
And typically, it's 10 to 15 conversations that I have to have before I hit that one person. So I went to one of the senior high-rises that's up in that area.
Okay.
In order to interface with that population. I just had a referral. I'm talking to some of the fire chiefs and the government officials that are up in that area, looking for what events do you have going on? Do you have a chicken dinner?
Yeah.
Do you have a spaghetti dinner? Yeah. There's always the Stoneboro Fair, but I'm hoping I can make some headway before September.
Yeah, we have a few months before that yet. So, but so we've mentioned the kind of these main groups. Were there any other particular factors that you sought out? We mentioned the economic one, we mentioned the geography and the age ones. Are there any others that would and maybe perhaps would be that people would be surprised by?
Education.
Okay.
education level is one of the social determinants of health. Now, it doesn't mean that you have to have a master's degree in order to be healthy. That's not necessarily it, but having access to good quality education is one of the social determinants of health. So I know whenever I used many years ago, I was on the advisory board with Ron Erret, by the way, of Mercer County Head Start.
Okay.
So I know the Head Start is a quality program that starts working with children very early, and they have a family component that's associated with that. So I reached out through Lori Johnson now to the Head Start program in Mercer County, and I am working with the Head Start program in order to reach parents.
Okay. Our guest here is Tracy Schleip from the Primary Health Network. She is leading the COVID vaccine equity team through Primary Health Network and the Buell Regional Health Foundation. I'm Ryan Briggs, filling in tonight for Ron Erret here on the Ron Erret Show. So after you've done the information gathering, and what's the next step? How and again, this is all kind of taking place within a relatively recent amount of time. What has happened since then? You had the information. I'm sure you probably looked at it, analyzed it, things of that sort, and then kind of put your plan in place, right?
Yeah, so our plan has been in place now for just under 6 weeks.
Okay.
So I reach out, remember that collaboration. That collaboration and networking is so very important. And I'm so grateful that over these years I formed relationships that allow me to call up folks and say, hey, this is what I'm doing. Can you help me? Can you help connect me with some people? So one of the things is Community Counseling Center. So I was invited to come to the drop-in center associated with Community Counseling Center. And what I found out from that was that persons who have mental health concerns are another population that is hesitant to get the vaccine. And for one reason, or they haven't received it, simply because they haven't been motivated or been able to direct themselves to get there, or they have concerns that it's not safe, which a lot of people have those concerns. So from talking to maybe 15 people that were at the drop-in center with Community Counseling Center, then I realized, wow, maybe what we should be doing is making vaccine assessment a part of regular client interfaces. So I am encouraging any of the social service providers who have regular interactions with their clients or consumers to simply ask them, have you been vaccinated? And if they haven't been vaccinated, you have two choices. Either you can give them my number, or you can actually help them to call my number, and over the phone I can actually get them an appointment to get a vaccine.
So that's a great and that's a population segment that and all of these groups that have been covered tend to be marginalized or pushed to the fringes a little bit, and when we say, oh yeah, those in low income or the older population, people are like, oh yeah, but then those with mental illness or mental issues, and that covers a wide range. I think that they are probably in some ways even more marginalized or more disadvantaged, because that's something that people don't feel comfortable talking about. It's one thing to say somebody recognizing a lower income or whatever, but the mental issues, that's something that I think really that doesn't get enough attention to begin with, especially in a case like this, where a group that's already marginalized even being pushed further away.
Well, mental health disease is a disease just like everything else, and we need to treat it as such. And so if we are spending this time trying to reach, for example, folks who are homebound, we weren't thinking about, what about those folks who really can't leave the house?
Right.
Well, somebody might say, well, if they're not leaving the house, then they're not going to contract COVID. But the thing is, they have people coming into their house in order to help them.
Yeah.
So we needed to make sure we were getting those people vaccinated. So how do you get a person vaccinated who can't leave the home? Well, fortunately, at Primary Health, they have a medical director, Dr. George Garrow, who is as passionate as I, probably even more
Yes.
passionate than me, to help get those folks vaccinated.
So now, again, that's when you, like you said, so people that, how do you get people that can't come out? How do you get it to them? That's another really just I think a great feature or that has been implemented. As we look here, we have about 5.5 minutes here, and this is what's been a very enjoyable and fast-moving segment. Might have to see if you can stick around for a few minutes after this. But as we get into here in the coming weeks and months, because while we're closer to the end, certainly, than we were even a few months ago, but kind of what are some, I guess, short-term goals? We know what the ultimate goal is to get as many people vaccinated as possible, and those who have the access issues with access to it. But short-term and intermediate term, what are you and the team? What are some goals? Do you have sort of like numeric goals in mind, or I guess any sort of what's kind of the some of the short-term goals?
You know, I have a steering committee that's made up of Jen Barbarak from Beale Regional Health Foundation, Nick Barron from Primary Health Network, and then Frank Giannetti from Public Safety in Mercer County. And I really rely on them to help provide me with direction, and never once have they told me that there's a number that I'm expected to reach.
Okay.
And why is that? Because every person we do reach is important.
Certainly.
And it's not necessarily about the numbers, but it's just about, as you said, making sure that those folks get vaccinated. So what am I doing? Well, right now, we know that it's opened up to ages, the Pfizer vaccine is now available to children 12 and over. So I am now looking to connect more with families and with children to help those children get their vaccinations, and also to make sure mom, dad, and the older siblings are vaccinated as well.
Okay. Our guest here is Tracy Schleip from the Primary Health Network here on the Ron Erret Show. She is here on behalf of the COVID Vaccine Equity Team Coordinator. And like you said, without having him, because it's hard to have a set number because you don't know what the exact number is. Has there been anything that has surprised you, you and the team? And you've been involved in many health endeavors. You've been involved in many facets with COVID from the get-go. Has there been anything here in the last few months that has really surprised you, either in a positive way or anything that was kind of like made you step back and go, whoa?
Yeah, there have been a number of things. One of the things, and I just shared this earlier this week, is, I thought I was pretty connected and I kind of had a firm understanding of what was happening in our county, and I'm finding out I'm not near as connected as I thought I was. And there are things that have been brought to my attention that I never ever considered. For instance, today I was at a meeting with the Mercer County Housing Coalition.
Okay.
And somebody asked me, well, what about folks under house arrest? That had never dawned on me before.
Yeah.
I had not considered, well, how are we going to get folks that are under house arrest vaccinated? So when I go into work at 7:30, 8 o'clock tomorrow morning, that's going to be the task that I set about to solve for tomorrow.
So one other question I have here is we're getting close to the top of the hour. Mercer County and neighboring communities. Of course, here, just, over the hill, and especially just, a stone's throw from St. John's Church is Ohio. And, of course, Brookfield and Masury and even Hubbard, we're all tied in pretty closely, but it's the other side of a state line. Have there been some difficulties or anything related to that because you're dealing with different rules, different guidelines?
Well, I think one of the things that's happened with the whole equity issue is because of that state line, that every state was handling their vaccination program a little bit differently. So for those of us who are living right there on the line, that complicated it. And some people thought, well, you can't cross the state line. If you live in one community, you can't go over to the other community and or the other state and get a vaccine. And that wasn't necessarily always true. However, sometimes it was true.
Sure.
Let's make it confusing,
yeah,
right?
It was.
And we know that different states have done a slightly different, better job at doing it than others. But I will say that right now in Mercer County, we have 33.4% of our population that are vaccinated with 2 doses. We call it fully vaccinated. So if it's Johnson & Johnson, you had 1 dose, or if it's Moderna or the Pfizer vaccine, you've had 2 doses. So 33.4%. Across the line in Trumbull, Ohio, it's 34.7%. Pretty close.
Certainly, yeah.
Right? However, if we look to Butler, they're at 40.4%.
So which is quite a bit higher.
Yeah, quite a bit higher. Lawrence County and Crawford County are a little bit lower than we are. And Venango County is the lowest of all of them. So if you look at that we here in Mercer County are about middle of the road.
Okay.
As far as vaccinations go. Now, what number would I like that to be? I'd love that to be 70% or higher. That's what I would like to see.
Well, I hear the music play. Tracy, do you have a few more minutes to stick around after 6? Great. We'll keep you here. We'll listen to the news together. We'll come back and we'll keep you for to kind of wrap up things. But a lot to cover here. This has really been enjoyable here with Tracy Schleip from the Primary Health Network. She and I will be back after the news break here at the top of the hour. I'm Ryan Briggs, filling in for Ron Erret. This is the Ron Erret Show on 790 WPIC. We'll be back with more after this on 790 WPIC. And welcome back to hour number 2 of the Ron Erret Show. Ryan Briggs filling in tonight for Ron. We are here at the start of the second hour, the same way we were at the bottom of hour number 1 with Tracy Schleip, from the Primary Health Network. She'll be with us until for about another 7-8 minutes or so till we get to a quarter after the hour. Then we will shift gears, but discussing the COVID vaccine equity team here in Mercer County. And one thing that you were telling me about off air, the Georgia Tech risk assessment tool, and kind of helping you in terms of giving you some additional data, things of that sort, based on the information known here in Mercer County. Can you tell the audience a little bit about that and what you've learned from it?
Yeah, the Georgia Tech risk assessment tool was created probably well over a year ago by a lot of minds that are brighter than mine at Georgia Tech. But what you're able to do using the Georgia Tech assessment tool is you can, this applies all over the world, but I can go to the map of Mercer County. I can input an event size into that tool, and that tool will give me back what is the percentage of chance that someone will be COVID positive at an event based on that size. So I check on that every once in a while to see what kind of a progress are we making. And back about a year ago, those numbers were just off the charts. You wouldn't even want to leave the house. Those numbers were that high. But right now in Mercer County, if we had an event with 50 people, the Georgia Tech assessment tool tells us that there's a 23% chance that someone there will be COVID positive, which, okay, 23% chance. Somebody might say, oh, it's a risk worth taking. But we're approaching summer. We know that we're going to be having larger events, fairs. So if we had an event in Mercer County today with 500 people, there is a 92% chance that someone will be COVID positive there. Now, to me, that says get your vaccine and get protected so that you can go to the fair.
Certainly, at 92%, that's a very high probability. That's 12 out of that's a 12 and 13 chance that somebody's going to.
Yes.
Okay. Now, the 211 informational number, of course, we know that there's certain the three-digit numbers. There was, of course, 911 for emergencies and 811 for to call before you dig, and 411 was the old information or whatever. But 211 has kind of become a public use type of number. And I understand from what you're telling me that now 211 for people in Mercer County can be used for those to get vaccine information, right?
Yes. Well, 211 is kind of the 911 of social service.
Okay.
So if someone were to call not 211 prior to my team coming into existence, and they said, I live in Mercer County and I'm interested in getting a COVID vaccine, they would have been sent to the Allegheny Department of Health, which is a wonderful organization, but I don't know how much good it does you if you're living in Mercer County. So now we have a single point of contact that if you call 211 now, you are sent to my team. And that number for my team, I'll give that to you so that everyone will have it. It is 724-977-3231.
Okay, 724-977-3231, and you call that number and you get the information you need or questions you have. You can ask them and you get the answers.
Yes, and if you're ready to get your vaccine and you need an appointment, we can even over the phone get you an appointment to get a vaccine.
So I know that there was one other thing as we wrap up here and as you proceed with your evening. I know that there was, I know you had one thing that you really wanted to ask of the population, anybody listening out there tonight.
Actually, I have four things.
Four things, okay.
I have four things. So I have four asks. Number one, if you or someone you love needs the COVID vaccine, please call so that we can get them an appointment and help them get transportation to that appointment if need be. Number two, if you're involved in an event or an activity where there will be people that I can talk to one-on-one, please give me a call. I'm going to want to be there or have one of my team members there. If you provide a social service, please consider making vaccine assessment part of your normal interactions with your clients. Find out if they're vaccinated, and if they're not, refer them to us.
Okay.
And then finally, respect people's right to self-determination. If you decide that you don't want the vaccine, I'm going to respect your right. I might not agree with it, but I'll respect it. So also respect the right to self-determination for those people who want the vaccine.
So it goes both ways.
Yes, exactly.
Well, Tracy Schleip from the Primary Health Network, we thank you for coming in. Thank you for sticking around for a few extra minutes here in the 6 o'clock hour. A lot to cover with the COVID vaccine equity team, and great things being done by you and your team already, and helping to help those that maybe need a little bit of a hand in getting information and ultimately vaccination. Thank you very much, and look forward to speaking with you again here down the road.
Thanks, Ryan. It was great. I had a good time.
I certainly enjoyed it, also learned a lot, and I hope our audience did as well. Once again, the phone number is 724-977-3231, or you can also dial 211, and it will be routed to Tracy and her team. That's the COVID vaccine equity team here in Mercer County and the surrounding areas. If you live in Lawrence County or over the state line, that number still works. You can call, and we'll get you, and she and her team will get you set up. Tracy, continue to stay safe, and we'll talk to you down the road.
Thanks.